right, it's Dr. Roach here. I have Maggie, and Jesse. Let's see what they talk about today.
We're on the spotlight.
Okay, birth control. So, there are different forms of birth control in Spanish and English. So I guess you're going to see the Spanish side today. Or English. If you guys ever interested in some birth control, I do all of the green. Orange, these are kind of more long-term. Sterilization, we won't talk about that at all. No one's getting that. But there's IUDs, there's Nexplanons, which just kind of go on your arm. IUD will sit in your cervix for 5 years. I can do, got votes for them. I can do Nexplanons. I just don't do them because there's not necessarily a lot of interest so far in pediatrics. But we'll see how it goes. I may do them in the future.
I like mine.
There
it
we
doesn't
go.
scar very much, but we can show.
There you go. Nope.
That's it.
Yeah, she
No
can show
scar.
hers. I can't show
You can
mine.
feel it right in here.
And I even have samples that show it is not that big, as you guys can see. This was an impromptu video today, by the way. But this is how big the rod is, that green little line you see down here. And as you can see, you can't see it. So highly recommended. It was not recommended in adolescents prior, unless you actually had already had a baby. But now they're recommended long-acting all the time. Blue. These are things you buy over the counter. These are things you do. Withdrawal, pull out, condoms. Sometimes not. They say these are about 75 to 88% effective. I do not believe those stats. I think it's more like 60 or 70%, and you will become pregnant.
Obviously, my plug-in more stronger. I got pregnant. First-hand experience. None of these are effective at preventing STDs as far as these two columns. These, it just depends on what you're doing, but always be safe. Always practice and preach that. So, pill, patch, ring, depot. You can definitely hear about those if you come visit me in clinic. Have a good one. You guys saying bye?
Bye.
Adios. Let's see, we're talking Spanish.